coming in for the order.
Okay, so here's the order.
Okay, doctor. Okay, so I'm checking and verifying. Yep. I'm also checking patient's medical history, past hospitalizations, checking H&P, progress consult notes, lab data, imaging studies, MAR, all that stuff. So order is done. Got it. I'm gonna wash my hands. Coming in, put my gloves on. My hand was sweating. It takes me forever to put these gloves on.
Okay.
Well, I know my hand was sweating so much I couldn't fit back into the mediums again. I rip a hole in them trying to get them on. Just send me with sterile gloves. It takes me an hour to put them on.
Just take your time.
I'm going to do it once again, just confirming everything. All right, now I'm going to get my supplies ready. My tool volume neb.
No, we don't.
Okay, I got my small volume neb. Spacer, cups.
Some napkins.
Yep, some napkins.
For sure.
Pick them up.
Napkins, right.
Yeah.
Got my puppies.
We're learning.
Right.
Stick some napkins in your cup.
Napkins and cups. And I'm going to grab these things from the med cart. Okay. So now I'm going to come into the room.
Sterile water.
What?
Sterile water?
Mm-hmm.
Oh, I thought it was showing up in the safe pocket.
No, what are you talking about?
The set.
Oh. Technical difficulty, I forgot to grab this. I keep thinking I have to like leave the room and come back for it. Since it's a medicine, I keep forgetting I can just put it in the bag. I can get it off. Okay, so now I can go into the room. Hi, I'm Devin. I'm your respiratory therapist student today. How you feeling? Can you confirm your name and date of birth for me? Awesome, thank you. Okay, I'm gonna take your respiratory. I'm gonna take your pulse rate. I'm also gonna observe the respiratory rate as I do it. Good. I'm gonna grab the pulse ox that I definitely brought into the room with me. All right, Mr. Stanley. I'm gonna clip this on your finger to tell me your oxygen level, and then I'm gonna check your breathing pattern, okay? Thank you. Stethoscope. All right, I want you to sit up for me and take deep breaths every time I move the stethoscope, okay? I'll be listening for a full breath every time I do this, doing it short for the sake of time. And I'm also gonna have the nurse help me hold him up while I check for thoracic excursion.
Mm-hmm. Good.
Thank you. All right, same thing on the front. Deep breath in and out.
Now you told me you had to start on the right, so if that's the case, you started on his left.
I keep, sorry.
I know, you're fine. I did it. I think I did it too.
We're gonna redo that.
Okay. There we go.
There we go. Awesome. All right. So I'm gonna check with the nurse, all the vitals. Everything's good. Everything's within range.
Yep.
Perfect. All right. So now we're gonna get started. I'm gonna document this. I'm gonna put this down here. I have my paper. I'm gonna document all the vitals. Everything's good. Awesome. Okay. So now we're gonna start your albuterol treatment, and this will help you breathe much easier. It'll clear your airways a little more. Get rid of those secretions, mucus. And this is my sterile surface.
That will actually never exist.
That will actually never exist.
But you will have one here.
This is the dream place. And the oxygen was on when I came in. see that. And I'm setting the flow meter to 8. Okay. So, Lori, I missed a step. I forgot to put on my little piece of whiteboard tubing. I'll also write that in my comments. I forgot to put it on. But we're here.
Oh, I'm not writing comments. I commented in the video.
Good point. There was my comment in the video. I forgot to set my whiteboard piece of tubing, but it is on now. And now we're ready to begin the treatment. Everything's non-kink.
That's not even a mistake because so the reason that is not a mistake is because you have to wait for aerosol, like a mist or that.
Anyway.
Yeah, you have to
Okay.
before you actually give it to the patient. So
I
you
see.
would have
Thanks. Sorry to manhandle you, Stan.
you would have realized it, like it. So you're fine.
That was a mistake.
So that actually does happen.
Okay.
I've had that happen to me in the middle of a breathing treatment.
Oh, jeez.
Especially, one, you might not put it on tight enough, or sometimes, like, the
Grab
patient's
my
real
down.
lazy and moves it around, or keeps switching hands, and it gets, like, loose.
Okay. Well, that was my bad, but we're good now. So I'm also going to coach Mr. Maxwell here to breathe normally, little deep breaths, and every 4 to 10 breaths.
No.
Every 3 to 4 breaths, hold your breath for 4 to 10 seconds.
There you
Mix
go.
up my numbers. And so I test his vitals and breathing before the treatment, and I'm going to do it in the middle. We'll assume he went through a couple cycles already of holding breath.
Right, but you have to explain the breath hold.
Yep. Okay. So every 3 to 4 breaths of the treatment, I want you to hold your breath for 4 to 10 seconds. This will allow all the particles to disperse within your airways and opening up a little more, make it much more easier to breathe, okay? Okay. So now we're going to assume we went through a couple cycles. It's now the middle of the treatment. We're going to reassess.
Correct.
All right, so continue the treatment. Don't mind me. I'm just going to listen to your breath sounds again, okay? Stethoscope is back on. I don't want that to fall out. Okay?
Here,
I think it'll be all right.
why you sound home.
I'll hold.
Okay. Same thing for the front. Okay, good. I'm going to check his pulse rate. I'm going to keep it on his respiratory rate.
Use the machine.
That's what this is for, Dave. You keep checking.
Actually, I would just keep that on their finger.
It
The
would
one
be.
finger.
Oh, you can just keep it on the whole
Yeah, just
time?
keep it on their finger. It's going to change up whenever. You'll see the difference.
Oh, thank you. Alright, so we'll do that. Keep an eye on everything, just in case. Respiratory, heart rate, and now we have
Everything's normal.
SpO2. Check with everything's normal. Perfect. Okay. So now we're going to continue with the treatment. Continue again with the hold the breath for 4 to 10 seconds. Every 3 or 4 breaths.
Are we going to continue this until the treatment is
Yep. So, and then once it begins to sputter, we'll realize treatment's almost over. And then he'll keep going until there's nothing left. Okay. So we finished your breathing treatment. Hope you're feeling better. Okay, good job.
Mm-mm.
Turn off.
I was like, and it dried.
And we're done. Next.
Devin actually cleaned it. That's like probably the right thing to do. But in the video, I'm just like, and it's dry.
Magically dry. Alright. So I'm going to put everything away, start documenting.
Hey, I did fold up my tubing. It's a plus. I didn't just throw it in the bag.
Alright, so assuming this is my little med cart with my other medications, we're going to document everything that happened. Everything's good. And now we're going to move on to the second treatment.
We got a call.
So so before I do that, I'm going to have Mr. Stanley cough before I get to the next medication.
Wait, was that cough supposed to?
After they've done the treatment.
And then there's a third.
She recommended.
Yeah, and then there's a third assessment after the
You do
cough.
assessment and then you do a cough. She said she did an assessment. Didn't you say you did an assessment?
I did.
Then you gotta do a cough.
I forgot the cough
You
though.
got the
Yeah.
cough.
Okay. All right. So we're gonna take a deep breath in. You're gonna hold it at the max inspiratory.
Tell them to cough to the goddess.
Oh, you're gonna cough right from your glottis. Oh yeah. You're gonna make an explosive cough because I know exactly. You know what that means. Oh yeah. All right. So he does his cough.
Yes, he's gonna close his glottis.
Yup, he's gonna close the glottis and give me an explosive cough. Thank you, Mr. Stanley. You're the best.
You're like, the goddess, what the heck? Okay, I'll try it.
So that's done.
Cough and then you spit.
You're gonna cough right into here. Give me that explosive cough. Thank you. I analyzed my sputum. I'm gonna put notes in there. Time of day, color, quantity.
Yeah, there you go.
There we go. Gonna
Yeah.
document all that stuff.
Yes. Good.
Okay.
I'll write that on my paper.
I know.
Yeah. All that stuff. We'll be looking for it. Okay, so now we're on to the.
Yeah, wait. Every video is just gonna have Etta cracking up in the background.
Sorry. This is fun. We're not being
We're
graded
gonna
on
shake
it.
it. We're gonna prime it.
All right, so we primed.
Okay.
Talk to him like he's Aiden, but not mean. Don't talk to him like he's a respiratory care student.
Okay.
Okay?
Got it. Okay, so our next medication here is a long-acting bronchodilator. This will help you.
Explain it to him like he's.
Oh, I think that I got it
Dumb.
wrong. I was like,
So
wait
the
a
next
minute.
treatment is this.
Okay, so your next medication is the Flovent. Yep. Am I doing one puff or two?
It's a steroid.
Steroid.
This is the steroid. This will help you breathe better. It's long-acting. It'll help you breathe over the course of 12 to 24 hours. It'll open up your airways a lot more. And,
Just explain how to do it.
fair enough.
He doesn't care.
Okay, so I shook it. I shook and primed it.
It's just to
So-
help with inflammation.
Yeah. It's,
Yes, it'll
This
help
time
with
it's to help with
inflammation.
inflammation. The long-acting
Yep.
Patrolman's help with
It'll
inflammation.
help with the inflammation over a course of up to a day. Okay. Everything's in. Okay. So what you're going to do is take a deep breath out first, and then breathe in once you wrap your lips around this tightly. Okay. You're going to breathe in once you got it here, and then hold for 4 to 10 seconds. Okay. Here we go. You got it. Slow deep breath in. Hold 4 to 10 seconds. And if I have a second dose, I will wait 30 seconds before administering the next one. So we'll sit here and we'll talk about how his grandkids never come to see him. Oh my goodness, can you imagine? Okay. The 30 seconds has passed. It's time for the next dose. Same instructions.
in.
Yep, slow.
Now pull that away from his mouth
Yeah.
because I didn't do it in my video either. I think it's because he's not actually breathing, so we're
Yeah.
caping it up to the
Right,
mouth.
So therefore, it's not really doing anything.
Yep.
Yeah.
So how can you hold his breath if his mouth is...
It
Right.
has the thing in it. Yeah.
Makes sense.
But, okay, so we corrected that, Lori.
Yep, yes we did. So that is finished. I'll give him a few minutes. I'm going to start putting everything away, and then I'm going to give him a drink. Well, not to swallow. He's going to rinse his mouth because it is a steroid.
Correct.
Okay, so I'm going to give you a little drink of water here. You're going to swish your mouth around, and you're going to spit back out into here. I don't want that steroid drying your mouth out and give you a thrush, okay? Thank you. Sound effects crew. Awesome. I'm saving these cups only because they're for that. Okay, so now I'm here back at the med car. I'm going to put the medication back. Chart and everything. Okay. All right. Second to last medication. We're almost done, okay? So for this one, you have a couple different instructions. I'm going to not prime this. I'm going to get this ready for you. Get the dose ready. And this one is breath actuated. So you're going to breathe in fast, but deep. And then also hold your breath for 4 to 10 seconds on this one, okay? Ready?
I say, take it away from his mouth. Take it away from his mouth.
Right? They're probably watching the video like, oh my god, she's
But
got it
see,
wrong.
like, that's a dumb mistake we're making in videos that I don't think is possible for us to make in real life.
Right.
Because, like, the person would look at you, like,
Like,
get
why
it
is it
out of
mouth?
my
Yeah.
mouth. You know what I mean? Like, I don't think,
And because he's not moving, it's just like,
yeah, we just are like,
we stop.
hold, and we freeze too.
So now we're documenting everything that just happened. Next, we're going to do the handy hailer. I'm not going to open this, but we're going to do
Okay.
for lab purposes.
So you're telling me these videos are about 20 minutes, 20, 25 minutes each, and Lori's going to watch 7 of them? Is that
Probably
weird?
not. She'll just skip to the important parts. Okay, so for the next medication, we're going to have the same instructions as last time. You're going to breathe in fast but deep and hold your breath for 4 to 10 seconds, okay? Okay. Okay. Now, should he ask me, you know, hey, I want to make sure I got all that medication, I can take it out and say, hey, there's a hole in here. It was punctured from this. If he still doesn't believe me, I can.
Break.
or
I
just
can
say,
break- I
let's
can
just
pull
check
it
to see
apart.
if you got all your medication.
Exactly.
Yeah, act like you're on his side.
Like,
You know what? Maybe you're right. Let's check.
You know what? Maybe I just totally sabotaged that for you. Let's go check. So I'm putting everything back in my cart. Okay, so here I am documenting again. Everything is good. Okay, now that all the medications are done, we're gonna rinse your mouth out one more time. After.
I know, I'm just...
Okay, so here's your drink
Just
again.
happy you-
Swish it around. Spit it out. Thank you. Thank you.
Oh, I didn't know you had
Okay.
one.
Yes.
So now we're going to have you cough one more time. And again, just make sure you remember, you're going to breathe in. You're going to hold your breath once you get to that max inspiratory level. And you're going to cough out, just explosive. Close that glottis. There you go. Here's my sputum. Document all the 5 parts about the sputum. Trash it. Document. All right, one last thing before I leave, Mr. Stanley. Can I take a listen to your chest one more time? Oh, thank you. You're the best. Stethoscope is in. Let's take a listen to the back. All right, lean forward for me. Check thoracic excursion one more time. I'm gonna break my wrist.
I thought Chelsea said you didn't have to.
Don't have to. That's what you want to do. Let her do it.
Okay, yeah, that's fine.
Just in case. Just in cases. Okay, one more time. Listen to the front. You're sounding much better already, Mr. Stanley. I hope you feel as better as you seem. Okay, one last time for the oxygen.
I love how you're calling him Mr. Stanley, too.
Oh, Mr. Maxwell. I'm so sorry. I'm gonna feel for your pulse rate, watch and respiratory rate, SpO2, and then double checking all the values. Everything is normal. Okay. And if the nurses don't beat me back to it, I'll check back when it's time for your next medication dose, okay? All right, thank you. Keep this on for you, but we'll pretend I'm turning it.
No, you're not going to have a tank in a hospital. It's going to be connected to the wall. It doesn't matter.